Hello, everyone. I'm going to be talking about a condition known as endometriosis. Please don't mind the medical jargon. Now, it is called endometriosis. I'm going to be explaining in layman terms so that everybody will be carried along. Before I explain what endometriosis is, I want to put this question out to you. Have you ever gone for a scan before and then the result came out and what was written there as the diagnosis was endometriosis? Even if you never knew what the definition was, nobody explained to you what it was. Have you ever seen that on a scan you did, or maybe a friend told you they saw it on a scan they did? Do not worry any further. I'm here to give you that explanation so you know what exactly it is all about. So forget about the medical jargon. Endometriosis is just a condition that occurs when the lining or tissues that are supposed to grow inside your womb, in the inner layer of your womb, now begins to grow on the outer layer of the womb. What do you mean? Now let me explain. Take for example, this my palm, okay, is my womb, okay? It's your womb. So the inner part of my palm is the inner layer of my womb, and the back of my palm is the outer layer of my womb. The womb consists of 3 layers. We have the outer layer, we have the middle layer, and we have the inner layer. All right, so use this palm as the womb. This is the outer layer, this is the middle layer, and the inner palm is the inner layer. So in endometriosis, what happens is that the tissues that should line the inner layer, which is the inside of my palm, now begins to duplicate itself on the outer layer. Don't be busybody be that. So something is supposed to grow in here naturally. And it chooses to become selfish. So it's growing in the inner layer, and it also goes to the back, to the outer layer of your womb to start growing again. Why? Why would you leave where God made you to grow, to be, to go and start multiplying yourself outside? They show yourself. Okay, that's on a lighter note. I just want you to understand what the condition is all about. It's not that difficult. So the inner layer of your womb, the tissues that line that layer, now begins to find itself outside, now goes on the outside of your womb to start growing. Okay, now how God made the womb naturally is that the inner layer is where menstruation happens. Okay, that's when the egg has stayed and is disappointed and no sperm fertilized it. The inner layer of the womb will now become thick. Okay, when it becomes thick, it now sheds off in form of blood as menstruation. I don't want to go into the process of what happens, but I'm just want to give you an understanding. All right, so because the tissues that line that inner layer, which is my inner palm, has found itself outside, which is not supposed to be. That's an abnormal situation. So when that woman is menstruating, okay, everything that happens in the inner layer during menstruation, this outer one that has come out to show itself here, will want to also duplicate what is happening inside. So you're menstruating. During the process of menstruation, there is inflammation of the inner layer of your womb. The walls are thickened. Do you know that the one that is outside here will also want to become thickened? It will also want to menstruate. How many places, for crying out loud, will menstruation happen? How can it be happening in the inner layer and also on the outer layer? Does it make sense? So that is what happens in endometriosis. It wants to show itself. The tissue wants to show itself. I can survive alone. You know, I can leave you and go outside and start growing and form my own community there. So if you're menstruating on the inside, I can also cause menstruation to happen on the outside. Do you get it? That's what happens. Unfortunately, for that tissue that is outside called endometriosis, it has nowhere else to go. It does not have where to hide itself because it had already left the inner layer where it was supposed to be and changed position. We don't have a place back in for it. It does not know where to go to. So what it does, it now starts attaching itself to surrounding organs. So I don't want to die alone. The inner layer has rejected me because I walked away, okay, and I found myself outside. So what do? I don't have anywhere else to go. It begins to attach to other pelvic organs. So anything it sees, it will attach to. It can attach to the fallopian tube. It can attach to the ovary. It can begin to form what is called scar tissues. It can begin to form what is called adhesions, where it starts attaching itself, to surrounding tissues around the reproductive tract, around your pelvic area, causing problems with fertility. It can block the movement of your egg, from being moved from your ovary as soon as it is produced, the egg is produced. This endometriosis can cause a blockage. Maybe it has attached to the ovary, so it doesn't allow the egg, when the ovary releases the egg, it doesn't allow the egg to flow through to station itself where sperm will meet it for fertilization to occur. The egg might even meet the sperm, but after fertilization, it doesn't allow the egg to flow and go through into the womb to implant itself. So this endometriosis is a problem. It's a problem. What chased it out from where it is supposed to be, the lining where it is supposed to be inside the womb, we don't know. It just goes off, goes and implants itself outside the uterus, outside the womb, and begins to cause havoc. It wants to menstruate at the same time where the inner one is menstruating, thereby becoming thickened, because when menstruation is about to happen, there will be thickness within the walls of the inner layer of your womb. This one that is outside wants to become thick at the same time. It also wants to menstruate. Unfortunately, it can't menstruate. But the only thing is that it can only succeed in enlarging itself. It can only succeed in becoming thickened, thereby causing pain. That's why sometimes people feel excessive pain during menstruation and you begin to wonder, where did I go wrong? This is beyond me. What can I do? You see people roll on the floor during menses. Most often it's caused by this infidel, this betrayer that left where he was supposed to be and went and formed himself outside the womb, and called endometriosis. It will cause inflammation and cause pain. It will cause adhesions because it will now hold on to whatever pelvic organ it needs, whatever reproductive organ it needs, is going to hold on to it. So the most significant symptom is pain. It can lead to infertility because it will block your egg from being fertilized by the sperm or even being seen. Even if fertilization, the egg and the sperm meet together, it might block its travel into the womb. Another symptom is painful intercourse or pain during intercourse. So you might begin to wonder, maybe as a man, you are, having fun with your wife and all she does is cry of pain. And you begin to wonder, this is supposed to be a pleasurable act. This is supposed to be something that should be fun. Why is this person crying? Why is this person in pain? Don't blame her. A lot of times it is because of endometriosis. It causes pain during intercourse. Okay? It makes the whole pelvic area, heavy pressure around there, a lot of things going on. And the woman becomes so uncomfortable. She doesn't understand her system again. She doesn't know what's going on. The bad news is that there is no permanent cure for endometriosis. But there are some, treatment options that people can explore when it becomes disturbing, when the symptoms becomes disturbing. Number one, pain relief. Taking pain relief. That's number one approach to the management of endometriosis because the pain can be so intense. So there is a certain group of drug or pain relief called non-steroidal anti-inflammatory drugs. For short, it is called NSAIDs. It stands for non-steroidal anti-inflammatory drugs. Now, this group of drugs has both analgesic property, that's pain relief property, and also an anti-inflammatory property. So it can relieve pain and it can reduce swelling. Remember I said that this endometriosis during menses is going to try to thicken itself up, it's going to become swollen, inflamed. So the reason why you're taking this group of drug that belongs to, NSAID, that this group of drug called NSAIDs, is because you want the pain relief property the drug has, and you also want the anti-inflammatory effect of the drug. So ibuprofen. So as an adult, you can take ibuprofen 400 milligram. One tablet of it, you might find in 400 milligram, you might find one tablet as 200 milligram. So if you find it as 200 milligram, take 2 tablets 3 times a day, okay, for 3 to 5 days, and the pain will be relieved, especially during your menses. If you find this as 1 tablet of 400 milligram, take 1 tablet 3 times a day for 3 to 5 days, especially during your menses. You're not going to experience the pain. Even if it comes, it's going to be mild because ibuprofen has both analgesic property and an anti-inflammatory property, right? Another drug is naproxen. Now, note this. If you have ulcer, you might not be able to take ibuprofen or naproxen. So you can opt for paracetamol or a drug known as cocodamol that has both codeine and paracetamol, but that cannot be sold to you unless it is prescribed by a doctor. All right. So just go to a pharmacy and explain your situation. If you have ibuprofen at home and you don't have ulcer, you can take it if you've been diagnosed with endometriosis during your menses. Number 2 approach of management is hormone therapy. Now, the reason why you or the lady will be placed on hormone therapy is because when you are actually placed on this hormone therapy, the aim is to make your body, put your body on a temporary menopause-like situation. So at the moment you are on that hormone therapy or hormone medication, your body actually goes into the menopause state where it feels like everything, all the fertility hormones are reducing, your menses will be either be stopped or it will definitely reduce the regularity at which it happens. So your body is going to be put on a temporal menopause-like state. That means when you are taking the treatment for endometriosis, pregnancy might not happen because temporarily the hormones that relate to fertility will be suspended. Do you understand? Okay. The last option is surgery. So if the symptoms become severe, you're so uncomfortable, and this is causing a lot of scar tissue formation, this is causing a lot of adhesions and problems, you may opt for surgical intervention. Yes, to remove that scar tissue. The surgery is called laparoscopy. It is just a minimal invasive procedure that will be done to take off the scar tissue that is formed by endometriosis, or to scrape up the tissue that finds itself outside. Just scrape it off so that we have peace. That's the final, management of it. It has no cure. The fact that surgery is done does not mean that the tissue will not grow back again. But just in the meantime, you can have peace and probably try to get pregnant when surgery is done to scrape it off. That's it. So endometriosis is not so popular, but it's there. A lot of women, I've had a few persons send me their scan results and the diagnosis was endometriosis and they're confused, man, what do I do? I'm telling you today, number one, there's no cure for it. There's no permanent cure, but you can help yourself with some pain relief that belongs to NSAID group of drugs, like your ibuprofen, like your naproxen. Okay, take this pain relief during your menstruation.